Siapa present?
Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Today I will be the case presenter, Muhammad Zakam Abdul Rahman. Okay. So today our patient is Nuha Tahsina, 2 years old, Malay girl. Went to HTAA due to rapid bleeding.
This is my lunch tau. No, you nampak I makan ni, I makan my lunch tau lah. Okay ha. No?
Doktor okay hari ni, doktor? Doktor okay hari ni?
Every day is the same. Okay, continue ha.
Okay. Okay, so our patient, 1 day duration. So here I have prepared the history, physical examination, investigation.
Tak payah cakap betul, just chief complain. Apa?
The chief complaint is the rapid bleeding.
For?
1 day duration.
Chief complain for 1 day. Finish lah. Chief complain shortness of breath, rapid bleeding for 1 day. Okay, present your HOPI.
The HOPI. So this so the history is taken from her mother. The mother said that Nuha was well until 3 days prior to the admission. She have cough and fever. About the cough is a productive, is a chesty and productive cough. The sputum is whitish and yellowish in color. The cough is worsen at night. Worsen in activity. The mothers claim that the cough is quite severe as the patient have difficulty to sleep at night. Okay, and then the mother tried to give ointment to relieve the cough lah. However, there is no sign of improvement. Okay, the mother noted that there is no barking or whooping cough. Furthermore, there are 2 episodes of post-tussive vomiting. The vomit contains digested milk and sputum. The quantity is about half cup only. And then other than that, the mother said there is no bluish, which is no cyanosis, and no facial congestion was noted. Okay, and then regarding the fever comes with the cough. The mother said that the Nuha was warm on touch. However, there is no temperature has taken because there is no thermometer available. And her mother said there is no chills and rigor. And it is progressively increased, and the fever is worsened at night. And 2 days later, on the second day of the illness, they went to clinic Kesihatan, and Nuha was given syrup PCM and cough mixture. However, the symptom does not improve. And on the second day too, Nuha has runny nose with yellowish and whitish nasal discharge. Okay, on the further question, both of the parents just recover from a fever, sore throat, and cough from the past week. So the mother has worried and assumed that her daughter might get infected from them. And then there's no loose stool noted, no reduced urine output, and the bowel output and past urine was normal. The patient was less active since the fever and cough. The oral intake has been reduced. Before the illness, the patient ate about 6 times per day, and now it goes to 3 times per day only. The patient is still on bottle feeding, and on also solid food too. Every day normally the patient eat about half plate of the normal solid food, and during the illness she only consumed about a quarter of the solid food. And the third day of the illness, the mother noticed the rapid bleeding, and and bring her to the emergency department STAA. However, there is the mother said there is no chest indrawing and wheezing associated with the cuff. That's for the history. May I proceed to systemic review, Doctor?
Finish your HOPI already.
Okay.
Have you finished your HOPI?
Yes.
Adib, any question?
During the first meeting with the patient, was there any observed of usage of accessory of respiratory muscles? For example, nasal flaring.
From the history that given from her mother, there is no use of accessory muscle.
That from history from the first meeting.
Oh, from the first meeting. Okay, let me check. Okay. There is yes, there is a use of accessory muscle as there is suprasternal and mid subcostal recession with no intercostal recession. So there is using of accessory muscle.
Okay, thank you.
Putri Aslan.
Regarding the past medical, does this patient ever had admitted before due to the same symptoms or any other causes before?
Okay, regarding the past medical history, this patient was admitted to hospital. Okay. 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 The patient was admitted to hospital Jerantuk before. It's about 1 month before this admission due to acute gastroenteritis. There is no known other medical illness other than that.
Okay, thank you.
Afiqah.
Afiqah Atira or Nur Afiqah?
No, Afiqah.
Can you hear me?
No, Afiqah.
Yes, can hear.
Yes. Okay. So I want to ask about the family history. Is there any history of atopy or history of asthma?
The family history,
Yes.
Okay. The parent, the mother state that there is no family history of asthma and eczema except for allergic rhinitis. Okay.
Izzah.
Is there any pain associated with the chief complaint?
Pain while rapid breathing.
Chest pain. Is there any chest pain?
Okay. Okay. Regarding the chest pain, there is no history of chest pain from the patient.
Okay.
Did they ask the question chest pain in this case? Do you think they asked the question chest pain or not?
I don't think they asked.
How old is the child?
The child is 3 years old.
3 years old.
2 years old, 2 years old.
Oh, 2 years.
Now, can 2 years old mention to you they got chest pain?
Oh, maybe if not, then maybe does the child seems irritable because of pain?
Probably ask that question lah.
Okay, and then Zakwan, does the child seems irritable or restless because of pain?
Okay. Okay. The patient from the admission, the patient is quite irritable because the patient was crying during the admission, and however after the admission the patient is not crying. So yeah.
Okay, thank you, Zakwan.
Next.
I want to ask regarding the patient's immunization history. Does the patient have completed his immunization based on the schedule?
Okay. Yeah. Okay. The patient has completed the immunization up to her age lah. After 18 months.
Edina.
Okay, I want to ask regarding the social history of patient. Does she exposed to any dust, any carpets in the house, or pollens, or are they have pets in the house, or even the parents is the smoking? Is it smoking or not?
Okay. The mother mentioned that there is no pets or carpets at the home. She denied any exposure to the allergens.
Atikah.
Okay, I want to ask whether this patient has any symptoms of sore throat, like crying.
Dengar.
Can you hear me?
Yeah.
Okay.
Suara tu halus sangat.
Oh, okay. Okay, I want to ask if this patient has any symptoms of sore throat, like avoiding the food or crying when swallowing. Okay.
Okay, wait. There is no history of sore throat from the patient. So yeah. Okay.
No history ke ataupun tak mention?
It is not mentioned in the case app. I think, yeah.
You see, in history, there are positive and negative. Faham? If there is no sore throat, they will write no sore throat. When you don't mention it, that doesn't mean it's not there or not there or it's there. Just that it doesn't cross your mind. That's all.
Okay.
Our assumption is that simple. You know, anything that been mentioned, that thing cross your mind. The thing not mentioned doesn't cross your mind. Hafiqah Hatirah. Hafiqah Hatirah tu apa maksud dia?
Maksud dia?
No Hafiqah. Hafiqah Hatirah. Apa maksud no Hafiqah apa maksud dia?
Afika confused Afika dengan Atia, tapi buat kebijaksanaan ni.
Saya yang
Apa?
Kebijaksanaan.
Ya, Atirah.
Atirah.
No Afiqah. No. Kenapa dia Afiqah Atirah no Afiqah? Apa beza dia? Sama ke?
Dia ada no, saya tak ada no. Adik-beradik saya semua tak ada no.
Yelah, tapi kenapa dia tak macam no Afiqah, Afiqah Atirah, Afiqah juga kan? Cara panggil apa? Kat rumah panggil apa? No Afiqah. Afiqah.
Saya ke Afika seorang lagi?
No Afiqah. No Afiqah rumah panggil apa?
panggil Afiqah.
Afiqah. You panggil apa? Atirah. Afiqah ke? Kat rumah.
Kalau dekat rumah panggil Along sebab sulung.
Sulung ke? Kat kawan panggil apa? Atirah.
Afi je. Afi.
Afi.
Sebab
Afi.
ramai sangat Afrika.
Sebagai Afi. Afi. Tak apalah. Anak I dia panggil Fifi seorang tu. Seorang masa Firdaus Fifi. Any other question?
I would like to ask regarding the nature of a chest recession. So the mother in a history of presenting illness, it mentioned the mother was unsure about the nature of chest recession. So when the patient come, I would like to ask regarding, that like the location of the chest recession, either it's subcostal or suprasternal or intercostal, and then either it involve one side only or both sides.
Okay, so what is mentioned in the PE is that the patient have suprasternal and the mid subcostal recession, but there is no intercostal recession. Regarding the chest, that's all. It's mentioned here.
Any other question? Any other questions?
I want to ask. Sorry, Musawa. Was there any family members or with the same symptoms?
Regarding the family members, during the patient's admission, is not stated here. However, the only that is in the case right up here is that both of the parents have sore throat for past weeks before admission. That's all.
Can I ask one more question?
Many question pun tak apa.
Just what I would like to ask, does the patient have any stridor, because the mother denied any wheezing. So what about the stridor? Does the patient have any stridor?
There is no stridor as mentioned in the case right up. So
any nosy breathing.
But there is sorry. But there is a generalized capitation.
Yeah, kita history lah. That one is examination.
Yeah.
In history, any nosy breathing?
No, doctor. Only rapid breathing.
No nosy breathing.
No nosy breathing.
How you want to shape between the wheezing and stridor in history?
About the maybe I think it's the whistling sound is a characteristic of wheezing.
Anything else? Dina, anything, any, is there any other way we can differentiate wheezing and stridor?
Can maybe that stridor is like snoring, right? If I'm not mistaken.
Stridor or snoring is two different things.
Oh, okay.
How about the expiratory and inspiratory? Kalau wheezing dia more of sound produced during expiratory. Kalau stridor, inspiratory.
Okay, anything else? That's all. Any other question?
Can I ask about the onset of symptoms? Is it gradual or onset, abrupt onset?
You're referring to the rapid breathing, right?
Coughing, the symptom on the onset of illness, fever, coughing, tachypnea. during the past 3 days? Is it from the start of the illness, the symptoms, is it onset or gradual?
Okay. If you ask the chief complaint, the rapid breathing, the onset is acute at the upon the admission lah. Okay. About the fever, fever and cough is 3 days prior admission. So the duration is 3 days.
Okay, can you hear me?
Yes.
May I ask a question? I would like to know the vital signs for this patient.
Ada? Vital boleh lah vital sign.
Okay, vital sign.
Hello, you free tak? Biskut sikit dah, aku balik. Buat ambil sikit biskut. Apa ni? Tu ada bilik ni, ada teaching Macam mana?
Okay, vital signs of the patient. Upon the clocking, the temperature is 37.5. Heart rate is 140 beats per minute. Respiratory 50 breaths per minute. Blood pressure 117 over 70.
170.
117
17.
over 17. Okay, and pulse oximetry 98% of saturation. Current weight 12.9 kilo, and current height is 90.5 cm.
Any other questions? Adik, you have listened to the history already. You think how significant the cough is?
The cough is significant to the case.
Why?
As for it is productive cough with yellowish sputum and not clear sputum.
That's all. You think that productive cough with yellowish sputum to the child will be admitted to the hospital? There are many child kat luar sana coughing not be admitted.
It is also associated with the fever and also the
talking about the cough.
Oh, okay. Yes, I think it is significant.
It's significant. But if you are a doctor, the child coming with cough and yellowish sputum, are you going to admit the case or not?
No.
I don't know how is it significant.
Doctor, can I help, Doctor?
No.
If it's solely on the cough, without knowing any other relating signs, then it would not be significant. But
there is a case, you know. There is the case. Oh, satu kotor, satu tu bawa.
Tak ada orang nak ambil kan?
Tinggal lah sini. If there is a cough only, I say to you, if there is a cough, is there any condition when the cough, because of cough, is going to be admitted?
Yes.
When?
When it is chronic cough for tuberculosis.
Chronic cough alone, I mean cough 2 weeks. Is there we cannot investigate our patient?
We can. We can investigate further. If
what's significant of that? Which cough that you want to know is important? Putri, what you think?
Maybe the characteristic of the cough, or whether it's like unusual, like barking or whooping. That's
so
when
what you think about the cough?
For the cough, it's just chesty in nature. That's
Then
all.
lagi?
It worsens during activity. Maybe it's asthma, not asthma.
Did the cough have the sound that you mentioned just now?
For this patient, she doesn't have any whooping or barking cough. It was just chesty in nature.
How frequent the cough?
It mentioned that it's prolonged bouts of cough which worsens when activity, and she can't even sleep comfortably because she coughs often enough, so it disturbs her sleep.
So you think the cough significant, not significant?
Maybe it's significant because it disturbs her, daily routine like sleeping. So she can't unable to sleep. She, can't. She is what do you call that? She is disturbed lah by the cough.
No, Africa, what about the fever? What do you think about the fever?
I think the temperature is 37.5, right?
Then
37.5.
what your comment?
It's so this is indicate fever, since the normal one is up until 37.4, right?
So
So
the fever is mild, moderate, or severe?
mild.
What you say mild?
Because the temperature and the mother told that the patient is warm on touch, and there is no chills and rigor.
Hot on touch baru dikatakan significant.
Significant macam kalau ada but on admission the fever is 38.9, so it's high, and she cannot
what?
But it improving because on the third day the vital sign is 37.9.
I want to know the fever.
Yeah.
What do you think about the fever? Just now the cough, mother can explain the cough, the child can unable to disturb the sleep, everything, those things. Masuk ayah, what you think about the fever? Mild, moderate, or severe?
Mild. Why mild, right?
Mild. It's not 38.8, 38.9 ada?
It's on the day
How
of
you
the
describe the
admission.
fever? Low grade, high grade, middle grade, persistent, intermittent. Tak tahu.
So fever is low grade persistent.
Low grade persistent. You got one episode 38.9, is it?
Yes.
Ada episode 37.4. Izzah. How bad is it, the shortness of breath?
The shortness of breath is bad because
You got treating only. Mild, moderate, or severe.
Maybe moderate.
No, the answer is no maybe. Once you're a doctor, you have to decide. Mild, moderate, and severe. Which one?
Moderate.
Why you say
shortness of breath.
moderate?
Because she is not in respiratory distress.
Not respiratory distress. Shortness of breath to not respiratory distress. Rapid breathing is not respiratory distress.
The workup says that she was not in respiratory distress.
What respiratory distress mean?
Respiratory distress, she wasn't able to breathe properly.
I mean that but if the child become tachypneic, it mean that she breathe proper.
No.
Huh?
No.
Pardon?
No.
What the first thing going to be the symptom when the child is having respiratory distress?
First, increase breathing rate.
So what the chief complaint in this case?
The chief repeat breathing.
Apa benda tu?
So it shows signs of starting signs of respiratory distress.
So my question go back. My question again.
So I guess I mean
why you think is that?
I think it is severe dyspnea.
Why?
Because she has shortness of breath even when
You
she
mean
is
that
not
patient shortness of
exhalation.
breath? Iqbal pun tak ada shortness of breath.
No, I mean she has the shortness of breath even with no exhalation, even at rest.
Lagi?
And she cannot breathe properly.
Mal also cannot breathe properly, what? Mal also cannot breathe properly.
She has can I change the
change lah.
So I change it to moderate because she doesn't show any signs of cyanosis or hypoxemia, and she doesn't show that she has
sinus.
She's not sinus. So the
So
dyspnea
that
is.
you mean that while the child on sinus only they becomes considered severe?
Yes.
So not sinus. Not sinus, I mean that the child is not severe.
And I think so. And her oxygen saturation is also high. Her oxygen saturation is also high.
So
I think it's not severe.
The child tachypneic on rest.
maybe it's range between moderate to severe.
You got three things only, mild, moderate or severe. Dia tak ada in between. Nick, what you think?
Sorry, Doctor.
Nick, what do you think?
I think it's mild.
Huh?
Mild.
Why you think mild?
Because there is no noisy breathing such as wheezing, and hold on. Hold on. There is no wheezing first. Firstly, there's no wheezing, and then there is no and then there is Zakwan mentioned that the patient is not agitated and he is alert.
Patient not agitated?
Yes.
Zakwan, betul ke patient not agitated?
In the report said the patient is crying upon admission, so agitated.
Sorry.
Are you surprised 2 years old crying on examination?
On examination.
How many children cry during examination at the age of 2 years?
Sorry, Doctor?
How many children cry during examination at the age of 2 years? Many, not many?
Many, I think.
So are you surprised, Zakwan?
Oh no, I mean when the patient come to the ED, the patient is crying. So we assume that this patient is irritated.
You tell me how many children at the age of 2 years going to cry when they come to ED, even when they are well? Many or not many?
It's like many.
So what's the big difference?
So we might say that this patient.
So my question to you, do you think the child is agitated or not?
Is it you asking me Musawat?
Asking you lah, you think the child agitated or not?
Upon the history given, I think the patient might be agitated due to the cough and fever. The fever is also high, right? So
how high?
39. Sorry, 30. 39 point. Sorry. 38.9.
I tahu tengok ni atas tengok pun dua kali. Nick.
Yes, Doctor.
So what you think, mild, moderate or severe?
I still think it's mild.
Mild. The child got subcostal recession. Smart mild. Do you expect the child with subcostal recession to be mild?
No, that's moderate, but I think moderate, Doctor.
Bukan apa? Why cannot be severe?
Because in severe, kalau breathlessness, no. Kalau severe, dia ada wheezing, Doctor. Wheezing dia usually loud.
Dalam apa?
Sorry, Doctor?
What you think? Share broncho pneumonia ada wheezing ke?
Broncho pneumonia?
Ada wheezing ke?
Kalau bronchopneumonia, maybe I think no. Except, I think no, except it gets very serious.
My question to you, you concern so much about the wheezing. Tapi if the child got bronchopneumonia, would the child wheeze?
No.
That's why you
Usually
worry
no.
so much about the wheezing.
Oh, just checking for the severity.
You mean everybody is everybody is severe must have wheezing?
Not really. What about the feeding, doctor?
I don't know. You ask me,
yeah.
what do you think?
Sorry. Feeding, the child is reduced. His feeding is reduced. So I think it's moderate.
Dina, what do you think?
I think it's mild.
Though we discuss the child got subcostal recession. You tahu ke budak ni simptom dia? When you listen the story pada Zakuan present tu, you masuk tak dalam you mental apa tu simptom budak ni? So if patient got subcostal recession, is mild, is it?
Moderate.
Moderate. You kalau main teka-teka tau, you have to analyze the history and tell me what do you think. If you think moderate, why can't it become severe?
Why can't it become severe?
Severe dia tak subcostal recession?
There is, but more severe than moderate.
In severe dia tak subcostal recession?
Yes.
Why it can't become severe? Why it must be moderate?
Because
Because what?
Is it because the partial pressure of oxygen is more than 95% instead of less than 90%?
My question to you, if you think the child is moderate, why you think it's moderate? If you think why it's not severe? Because saturation.
Yes, and that also.
What if I told you the child is breathless at rest?
Sorry, doctor?
The child is breathless at rest. You tak ingat the symptom, you tahu tak? You dengar saja, you tak dengar, you tak ingat the symptom budak ni.
Doctor, would there be any difference if the patient is tachypneic at rest and patient is dyspneic at rest?
Apa beza dia?
If by definition, dyspnea is shortness of breath, but tachypnea is only rapid.
What tachypnea represent?
Rapid.
Rapid breathing.
Rapid breathing represent what?
Due to the compensation.
Due to?
Compensation.
Due to?
Compensation, doctor.
Yeah, due to what? Compensation of what?
difficulty to breathe because accumulation.
What's the shortness of breath and difficulty in breathing? What's the difference between shortness of breath and difficulty in breathing? Adik, what's the difference between the shortness of breath and difficulty in breathing?
It is the same, but what if it is not due to difficulty in breathing, but it's due to the impairment in gas exchange in the lungs?
Impairment in gas exchange in the lung. Why the patient develop the impairment in gas exchange in the lung?
It can be due to effusion.
Pardon?
Cases like pneumonia, pleural effusion can disrupt the gases exchange.
Pneumonia and effusion. What it cause?
Inflammatory response,
Yes,
hyperstitution
what
of
it
mucus.
cause? Usually it cause what?
Hyperstitution of mucus, vasodilation.
Yes, I know. What the patient, not what it caused by what? What it going to cause?
Dia akan cause apa? Fluid accumulation in the
Yes.
alveoli.
At the end of the day, the child, what the child feeling?
Air hunger.
So what do you call that?
What we call that?
Shortness of breath.
Shortness of breath.
Shortness of breath. The air hunger.
Tell me what's the difference shortness of breath, difficult in breathing, dyspnea, breathless. Apa different dia?
Bukan sama je ke doktor?
Tahu pun.
Sama je kan sebab dia kena apa? Dia kena
Physiology is the same.
inhale lagi banyak.
The physiology is still the same.
So doktor just nak clarify, kiranya tachypnea, shortness of breath merujuk pada benda yang sama lah.
Tachypnea is a sign or symptom. Shortness of breath is a
presentation.
Is a
symptoms.
Condition.
Is a what, doctor? Pardon?
Condition.
We can't hear you clearly.
Condition.
I can't hear you clearly.
Condition.
Condition. Oh, condition. Oh, all right.
In matter of nuance in English, that's all.
Oh, so shortness of breath, the patient will present with tachypnea, macam tu?
Yalah. What is the first thing you want to present in children? If they got shortness of breath.
Apa doktor?
What is the first thing they're going to present in children if they have shortness of breath? What's the thing they're going to present? In children, if they have difficulty in breathing, what's the first thing they're going to do physiologically?
Nasal flaring. Necessary.
Pardon? The first thing will be increase in respiratory rate. What we call that medically?
Tachypnea.
Orang biasa kalau orang kampung macam you all ni panggil apa?
Tercungak-cungak.
Nafas
nafas laju.
Rapid breathing dia bahasa orang kampung macam you all. Bahasa doktor apa?
Tachypnea.
Bahasa doktor tachypnea. Bahasa orang kampung layman ni semua dia panggil rapid breathing.
Nafas laju.
Tapi that is the sign and symptoms. The condition dia ialah
shortness of breath
or difficulty in
breathing.
Diagnosis dia ialah Diagnosis dia can be
A few.
tahu pun. Siapa yang confused? You ke I? You all ke confused?
We all yang confused. Sekarang dah clear dah.
You don't
Doktor
know
explain dah
which one
clear.
is layman term, which one is the medical term. If you go to the conference overseas, everything semua, they will mention about the among you all, they will say that my children, my patient is takib. Yeah. Cuma orang Melayu, orang Malaysia, dia pakai betul rapid breathing for your information. Idina, tak habis lagi. What do you think?
I think it's still moderate.
Why? Why it's not severe?
Maybe because the chest recession is not too severe.
Ada mention, Zakwan, how bad the chest recession?
It is not mentioned. What is mentioned?
Then you not mention. You assume maybe we want from the facts, history. You have listened to the history. What is from your interpretation of the history? Atika.
Okay, I think it's moderate because according to the history, patient has patient has rapid bleeding when there is a bout of coughing. So that's mean patient can still has the feeling of breathlessness during talking. So apart from that, patient also
How you know
has
patient got feeling of breathlessness?
Rapid breathing. Rapid breathing.
Rapid breathing. So patient got feeling of breathlessness.
Yeah, usually.
She told you. Patient told you.
No.
You assume.
No, because yeah, I assume. But,
Yeah. You assume.
because,
Assumption. This is your assumption.
Because just like Doctor
You
said,
think
usually
how true is your assumption is? The percentage of your assumption is true. How many percent?
more than 50%.
More than 50%. Bila berapa? 70, 80, 90, 100?
80 maybe.
80. 20% you are wrong. 80% you are correct.
Yeah.
Yes.
Yes.
So maybe you are wrong, is it?
Yes. because I'm not so sure. Because yeah.
How you want to be sure? If the child complain to you, they got breathless.
No, because usually they cannot tell us that they are feeling breathlessness. They just showing the feeling of breathlessness through their presentation, such as they cannot talk, or maybe if they can talk like other children, they can talk properly. But during this presentation, they difficult to talk like maybe talk like in phrases only.
So what about this child? Can he talk in?
I think this child is 2 years old, so maybe uh, uh, she can say like 3 to 4 words like mama, water, and when if this patient has this feeling of breathlessness, when she will have like cannot properly say the words mama, like that.
So is there anything in the history that told you the child is talkative or not able to talk or not?
No, according to the history, no.
No, why you didn't ask just now?
It doesn't cross in my mind.
Doesn't cross your mind. Sekarang will cross your mind.
Yes.
You think important, not important?
Yes, very important.
Why not it cross your mind?
Okay. Sorry, doctor.
Afikah, tell me all the sign of mild respiratory distress. The symptom mild respiratory distress. Ada depan you, baca tu. Afikah, Afi. Baca.
My respiratory baca.
Baca. Tak ada buku depan you. Apa tu mild? Orang depan semua macam Atikah di depan dia buku tu. Siapa lagi ada buku tu? Semua dia jenguk tu. You tak ada?
Oh. Saya ada laptop.
Tak ada buku depan you. Cari apa nak tanya soalan. Tak ada?
Oh, ada laptop.
Ada laptop. Mild. What is the symptom of mild?
How mild different with severe ke, doktor?
Tell me all the sign and symptom of mild respiratory distress.
Tachypnea.
Siapa ada buku ke? Depan buku. Afikah. No, Afikah ada buku. You ada buku depan you? Siapa cakap tadi? Adik sebut wheezing tadi.
Musawah, doktor. Wheezing.
Pada?
Yang wheezing tu Musawah, doktor.
Musa apa?
Nick Al-Musawah.
Apa tu?
Nama member ni Dr. Nick Al-Musawah.
Kenapa?
Tak, tadi doktor cakap yang sebut wheezing.
Siapa? Nick. Nick.
Ya, saya doktor.
Okay, so we list apa kalau mild respiratory distress apa benda?
Breathlessness when walking.
Okay.
Talks in sentences. Maybe agitated. Respiratory rate is normal to mildly increase. And absent of accessory muscle usage or retractions. And wheezing can be moderate and often only and expiratory. Partial pressure of oxygen is more than 95%.
Kalau moderate apa?
Kalau moderate, breathlessness when talking, but for infants, it have feeding difficulties. Talks in phrases. Alertness usually agitated. Respiratory rate is increased. Use of accessory muscle or retractions is present and moderate. And wheezing is loud. Partial pressure oxygen is 92 to 95%. Severe is breathlessness at rest, but for infants it stops feeding. Talks in words, usually agitated. Respiratory rate is markedly increased. Accessory muscle usage or retractions is severe, present and severe. Wheezing is usually loud, and partial pressure of oxygen is less than 92%.
So Afikah, what do you think?
What I think, severity dia.
You heard the criteria given.
Saya rasa moderate.
Tell me the first one. Apa first one the criteria? Nick.
Breathlessness.
Breathlessness.
So this child breathlessness pula.
Dia tak sebut, tak mention.
Tak mention ya? Zakawan? Budak tu susah nafas, noted to be...
Tak mention kan?
Zakawan?
I think I didn't come across that. It is not mentioned.
Pardon?
It is not mentioned in the case.
when the child takimnik tu, takimnik masa bila?
Dia cuma cakap yang one day duration before admit tu, dia mak dia perasan dia takimnik sekali dengan batuk. Macam
That's
tu je.
all. Takimnik at rest or takimnik at the playing, takimnik?
No. There's
Tak
no
ada.
further info about the rapid breathing or the takimnik.
Okay, nanti the feeding?
Feeding?
Feeding
ada, mak dia mention. Feeding dia makan tak apa ke doktor cakap Melayu ke kena English?
Gantung pada you lah, kalau nak pandai tak nak dia pandai.
Kalau feeding dia makan kurang daripada biasa. Biasanya dia makan half plate tapi dia notice during the illness
feeding.
Decrease in feeding, quarter plate je.
3 years old child. 2 years old child. Lagi?
Lepas
apa
tu,
lagi?
Breast milk pun kurang juga.
Okay, sambil feeding apa lagi selepas tu?
Selepas tu talks, breathless, yang criteria of severity of respiratory distress tu ke doktor? Yang kriteria yang Musawar sebut tadi ke?
Yelah.
Yang pertama breathlessness yang tadi dia tak mention. Lepas tu talks in phrases ke, sentence ke, word. Ni pun tak ada mention.
Lagi?
Dalam SPI. Lepas tu alertness, mother dia cakap dia conscious dia. Tak ada pun altered mental status.
Agitated tak?
Tak mention.
Dia cry kan? Cry a lot or not? Cry budak ni?
Dia cry ke?
More than usual, sama. Dia cry because of fever ke, because of cough ke, because of shortness of breath ke, mana satu?
Dia tak mention dalam HPI.
But the child is crying a lot, is it? Zakuan?
I don't think they mention pasal crying.
As the doctor said before, children always cry at ED. So
about this child?
About this child, this patient very likely to be agitated because she has a very high grade fever and persistent cough, prolonged cough. So agitated.
So dapat you think the agitated is due because of other thing?
I think kalau agitated mungkin kalau ada associated with chest pain ke.
2 years old chest pain ya, you cakap?
Kalau dia macam crying.
You got a lawyer sepatutnya.
Tak ada mention pasal crying dalam HOPI.
Okay, ada apa lagi? Next one
Lepas tu respiratory rate. The respiratory rate take it me.
Ada lagi more important the respiratory rate.
Usage of accessory muscle. Tak notice any uses of accessory muscle. Tak ada.
Zakuan?
Upon the admission, there is
what the mother mentioned in history.
The mother did not notice any chest recession lah.
Subcostal recession.
But the subcostal recession is on the PE during PE.
Why did you notice subcostal recession at all?
Dekat HOPI mak dia kata unsure. Mak dia cakap unsure.
Any unsure of subcostal recession or not?
Mak dia kata unsure.
Mana mak dia? Mak dia education mak dia baca sikit.
Tak ada. Mak dia.
Baca Zakuan education mak dia.
Education mak dia. Her mother is a policewoman.
Tak nampak subcostal recession, policewoman.
Tak nampak.
Pakai apa mak dia?
Tu tak sure tu. Saya rasa mak dia cemas ni doktor. Mak dia cemas ni tengok anak ni tu.
Cemas. Tapi duduk rumah berapa lama mesti few hours at home lah. You also you all as a mother going to miss or not chest session?
I think it's not that easy to notice the chest recession. Mungkin dia macam nampak lain tapi kita tak sure tu chest recession ke tak. I think so. Pardon doktor?
Let's say you are mother, you tak ada education, you boleh notice tak chest recession tu? Subcostal recession, intercostal recession, suprasternal recession. Can you notice? Can you miss that?
Can you miss that? Dia mungkin dia perasan something wrong, something abnormal je lah happen on the chest. Dia tak tahu benda tu chest recession.
Oh, dada dia masuk ke dalam sedikit. Cannot say that.
She can say that.
Unless something wrong with your eyes, sure boleh nampak. Then you see you are taking care of the child for 2 years. Sure you nampak something wrong with the breathing. I have not seen mother not notice yet. If you ask them, ada tak mama tu dada masuk ke dalam ke bergerak ke dia ni? Father, yes. Half of the father notice, tak notice. Not half, 80% mother tak notice. Father memang tak notice punya, tak notice anything. Well, you don't think you'll become that kind of father, Zakwan?
I think if I am a doctor or maybe
doctor, if you are a father, you think you're not going to miss it?
I can say that because
wow, see Zakwan confident lah. It will be a kind of father who not going to miss.
Bukan itu, maksud saya selalu kan bapak ni kan sibuk bekerja.
Wah, mak tak sekerja. You agree with her? You think the father only working now? Atirah, Yafiqah, you think that now is only the male is busy working?
No. I disagree.
Sometimes mother kerja sama kuat, dia tahu tak? Cuba bila mother balik rumah, mother kerja lagi. Ayah duduk tu betul? Duduk tengok TV lepas tu. Mak kerja lagi. Tak percaya? Oh, you akan tolong isteri you basuh dapur, basuh pinggan ni semua, you going to help that? Are you that kind of father? Sama-sama buat?
Jarang berlaku tapi kita boleh try, tapi jarang lah berlaku.
Boleh try lah boleh try lah. How you want to solve this problem? Supaya this thing not going to happen.
Problem.
The only way to solve this problem is that bila you ada anak lelaki, you suruh dia masuk dapur seperti anak perempuan. You make it like that. If you make it like that, sama-sama buat, biasa dia dah jadi part of dia punya ni. Tapi kalau anak lelaki tu follow you juga, baca surat khabar isteri kat dapur, tak ada apalah, samalah. It won't change anything lah. Kan? Okay, Adib, what the essence of the case?
The essence of the case, 2 years old, with a rapid breathing for 1 day duration.
Okay, this child is 2 years old with rapid breathing, shortness of breath. I suka pakai shortness of breath, suka pakai rapid breathing. So what the next thing come to your mind?
The management.
Putri?
I would think that something emergency lah, rapid breathing for 1 day duration, something acute. Maybe she's.
This is how old child? 2 years old.
2 years old.
Child who are having shortness of breath for 1 day. Shortness of breath for 1 day. No, Afiqah, what do you think? What next thing come to your mind?
The causes of breathing pneumonia.
Is that
The causes of
what is the
this
what is the causes of
is the cause of the rapid breathing.
what is the causes of shortness of breath?
Shortness of breath.
Hilang ada. So before you want to know the cause of shortness of breath in this case, what you need to know first?
History of close contact.
No. My question is, you want to know the causes of shortness of breath in this case. Before you want to know the causes of the shortness of breath in this case, what you need to know first? Iza?
Severity, Doctor.
We did discuss severity dah. Tadi kita discuss dah. We decide agree is a moderate.
Associated symptoms?
Symptom tu apa? Now you want to know the process. What is the thing you need to know first before you want to know the causes of shortness of breath in this case?
Can I try, Doctor?
Yeah, time will come. Sabar.
Possible causes.
Pardon?
Firstly, possible causes dia maybe boleh jadi bacteria atau fungi.
The differential diagnosis.
You need to know all the causes of
shortness of breath.
How you want to diagnose causes of shortness of breath if inside you don't have the knowledge all the causes of shortness of breath? Okay, tell me all the causes of shortness of breath in 2 years.
In 2 years old. Pneumonia, bronchopneumonia.
Lagi?
Foreign body aspiration.
Lagi?
URTI.
UTI cause shortness of breath. MCQ. True or false?
Oh, false.
Idina.
Asma.
Lagi?
Bronchiolitis.
Lagi?
Croup.
Lagi?
Foreign body aspiration.
Ya, kawan dia cakap dah. Afrika, you to add anything tak? Afrika, I pernah dapat kedai cimata besar boleh tu lagi. You nak tak? Ada tu. Habis tu anak I besar pula. Warna hitam. Ada lagi kos?
Epiglottis.
Epiglottitis. Lagi apa lagi?
Cardiovascular disease, tapi
what you call that? Cardiovascular disease. When you ask your causes, you give the possible diagnosis. Apa lagi?
yang apa? Yang possible tu tadi macam Idina dah sebut.
You talking about cardiovascular causes. Apa?
Congestive heart failure.
Lagi?
Congenital heart defect.
Congenital heart defect cause shortness of breath.
Sebab dia tak dapat accommodate
More VSD.
VSD, ASD.
Very small VSD causing shortness of breath.
Very small, I don't think so.
Then?
Sinuses, heart, like the trilogy of Fellow.
Trilogy of Fellow cause shortness of breath.
Kalau severe.
Doesn't matter. You're talking about not severe.
Kalau cyanotic heart defect.
Which one? Zakwan, where you can get all the causes?
From Mr. Google.
Lagi?
From the books.
Susah sangat. Kalau you baca malam tadi, you boleh dapat, you boleh bilang answer ni dalam macam ni je tak? You baca malam tadi, my case is a shortness of breath. So I'm going to baca all the causes of shortness of breath. Can you listen to me down all the shortness of breath? Causes of shortness of breath.
Wait.
Tak dapat nak list.
Okay, about the cardiovascular ke semua je?
Semua lah.
Okay lah. Kalau cardiovascular?
Semua. Baca semua.
Okay, respiratory controller, INSA. Okay, the problem in the brainstem, DKA.
Kenapa you cakap yang uncommon dulu? Sebab tu you susah, hidup yang susah.
Yeah.
You say that you think if you mention DKA, you not mention DKA in 2 years old, I'm going to fail you. Which one I'm going to fail you? You don't mention bronchopneumonia ke?
Bronchopneumonia.
Or you tak mention DKA?
Bronchopneumonia.
That's called logical thinking. You're talking about children 2 years old. That's why your life difficult. Your life difficult because you all think the complicated and rare thing first. Why not you think the simple thing first, yang common? What the causes?
The bronchopneumonia, bronchopneumonia.
You see, that's why you wastage your time tau. You belajar cara yang menyusahkan diri you all. Katalah you all already read this case. You dah baca this case. You dah study this case. By the time I ask you what the causes, you tak payah tengok depan you apa-apa tu. You just mention sebab you dah hafal dah. Bronchopneumonia, bronchoasthma, bronchiolitis, foreign body, empyema, pleural effusion, pneumothorax. Mention dah. Cardiovascular, congestive cardiac failure, acidosis. You faham tak? Aku cakap, budak I tahu dia baca malam tadi. Then you see, you memorize it, and then you present it, you ingat semua hidup tau. Because you already study the case. Kalau you nak dia pandai lah, smart clinical lah, that's how people study clinical tau. We study around our patient. Doesn't matter you got this history pun you tahu you going to present today. You dah check dah all the courses. You dah check all the courses, then you dah study. So I can ask you, do you think patient got foreign body injection?
No, doktor.
Sebab tak ada history, tak ada dalam
Tapi
history.
if you know already this one of the courses, masa HOPI tu, you dah boleh komen dah. No, you say that I don't know tu, I cannot, from the history that they give to me, I cannot rule out patient got foreign body injection because I don't know the previous student check the patient got foreign body, is the child got foreign body injection or not. That I know that you are using your brain. You already study about the case. You see, when you ask the question, sometimes you fikir, or when we ask you question, we don't assess you. The quality of the question tell me the quality of your mind. I ask you, fresh foreign body injection, is it a common sense or not common sense? For baby children who have short nose surgery in one day.
Common sense.
Common sense. So what's difficult about the medicine? If you have common sense inside you is strong, you think that medicine become difficult. Medicine become difficult because you all belajar cara susah. The way you all belajar, they susah, make medicine to the difficult. So Atikah, do you think the child has got bronchiolitis? From the history you have listened just now.
I think no.
Why?
Because the age of the child is usually for the bronchiolitis, the age is under 2 years old, and
The age is under his old 2 years and below.
I think I've read below 2 years old.
2 years old, below 2 years old. I mean that 1 year and 11 months and 30 days. Or is it 2 years and below? Definition.
I'm not sure. Yeah.
Not sure.
Yeah.
Anything else? Why you don't think bronchiolitis?
Because these patients got no wheezing. Usually in
Must you have a wheezing in bronchiolitis in history?
Okay, sorry, not. Because usually in bronchiolitis, the cough is dry and sharp, but in the cough is dry and sharp.
Why is it dry? The cough is dry when the airway is full of secretion in bronchiolitis. You know the pathology of bronchiolitis is airway is blocked by the
secretion.
Atikah, do you think it's asthma? No, Afikah seorang lagi. You think asthma or not? Afikah?
Can you hear me, Doctor?
Dengar dan tak dengar.
So asthma occur in older children.
Ada? Tak dengar. You kau sebanjir ke? You duduk mana?
Saya duduk besut.
Besok banjir sana.
Tak banjir tapi hujan.
Akan banjir lah.
Maybe.
Maybe. Pernah banjir situ?
Tak pernah banjir area dekat-dekat rumah, tapi kat rumah tak pernah naik air.
So what you think?
Asthma usually occur in older children.
Usually, but not always. Minit 2 years old tak boleh kena asma.
Boleh. Tapi dia tak ada history of family history yang ada asma.
Ya ke, Zakwan?
Yes, doctor. Except the triad, the family only have allergic rhinitis.
Still allergic atopy. Is it the first admission? Any previous similar history?
No, doctor.
This is the first time?
Yes.
Adib, can it be heart failure?
It is less likely to be heart failure. There was no edema.
Edema of what?
Pedal edema, leg edema.
Pedal edema. In children, must it be a pedal edema to have a heart failure?
No, pedal leg edema.
Leg edema lah. The children must all have a leg edema to have to be a heart failure. In children.
No. It is also very acute. It is non-progressive rapid breathing.
The patient develop about myocarditis, inflammation of the heart, secondary to viral infection. They cannot have sudden shortness of breath.
They can.
Hafika Hatira, you think it's hard or not? Why can't it become hard?
Why can't it become hard? Because the symptoms not really consistent with sign and symptom of heart failure, such as peripheral edema.
I told you already, I asked you the question. You think all children develop ankle edema before then they only got heart failure?
Not sure.
Many children, small children, they don't have peripheral edema when they develop heart failure. Tak boleh nak goreng dah. Setakat itulah yang boleh goreng. Putri?
Maybe for heart failure, patient could have cyanosis.
Heart failure cyanosis. Heart failure cause cyanosis, true or false?
Maybe false could, but depend on what kind of disease it is. Either right or left shunt.
What we're talking about heart failure?
False could, doctor.
Yalah, tapi we're talking about heart failure now. Do you think this child is having heart failure or not?
I don't think so. Besides because heart failure.
It's not specific.
Maybe because there is no signs of heart failure like ascites.
Children, I told you, in children, small children, fluid accumulation sometimes they don't have. The smaller they are, less likely they have the need. You can have only pulmonary edema only without ascites.
Maybe because the patient present with fevers.
Fever. mean the child got, I said, if the child got myocarditis secondary to viral infection, they come with fever and sudden shortness of breath.
Because of inflammation.
So you say it's not less likely to cardiac failure. Why you say that? What is your evidence? Knowledge tak. You see, if you have the knowledge of heart failure, you can answer that, is it? What are the heart failure specific signs, symptom of heart failure? Autopnia, PND, decreased effort tolerance. Sebab your brain tak lagi berpusing-pusing, berputar-putar macam brain doctor. Brain doctor ni cepat. The sign and symptom of heart failure specific. Tidur patient tidur bantal. Ada autopnia tak? Patient decrease effort tolerance. Patient ni kalau dia berlari ni semua ada become more tachypneic or not, breathless, cannot stand. Or the child got PND, sleeping at night, middle of night, ada shortness of breath tak? They have cough, a lot of cough because of the pulmonary edema. Wah, the child got cough. Susah medicine ni. Susah. Hafika, susah ya? Banyak sekali benda nak tahu.
Fika, seorang lagi.
Kalau panggil no Afikah, apa panggil no, you panggil Afikah.
Oh, okey. Susah ke? Lupa sebenarnya. Yang doktor cakap tu pernah belajar dah dekat preclinical.
Kenapa tak ingat?
Tiba blank pula.
Sebab
fokus dekat respiratory system, so tiba-tiba blank bila doktor tanya pasal cardiology system.
Shortness of breath is symptom. The child got pain abdomen, can have shortness of breath. The child got severe ascites, can shortness of breath. The child got muscular pain at the abdomen, can shortness of breath. You're breathing, abdomen tak dipakai. The child got acidosis, acute renal failure, anemia, semua kan shortness of breath. Shortness of breath ni dia causes dia is so many. The child got meningitis, brain lesion to the respiratory center, dia got tachypneic. Dia dah shortness of breath. Dia got tachypneic. Because of the brain stem not regular. So I hafal ke? I hafal ke I work out? I hafal ke I work out?
Work out, I think you.
How do I work out?
How do you work out? I think you think systematically.
And I have a very good foundation in the basic sciences. I don't need to memorize. Okay, work out. So who's enjoy the life, you or me?
You.
I don't need to worry. I enjoy. I don't need to memorize. So makan pun I will tell you all the cost. How to get it?
How to get it?
It's that you have to decide your life. You want to become a professional doctor or not. This called. You think wiring in the doctor, wiring in lawyer sama ke? Dalam brain wiring doang.
No.
Yeah. Tak sama, the way, the drawing tak sama. Doctor, they have their own way to look things. Lawyer have their own way to look things. Because it's how the brain be wired. How to get that? How to get? Macam mana dapat?
Study hard.
You baca 10 kali, you pelik tak orang tu baca 10 kali, orang tu baca sekali, 2 kali, tapi orang baca sekali, 2 kali tu dia dapat terus. Dia orang baca 10 kali tu tak dapat.
Study smart.
Okay, anything? You decide lah, you want to have easy life or you don't have easy life. The keyword I can tell you is passion. Passion, bukan passion, PT, PASSION. Any question? If you're passionate, you're not going to suffer. You enjoy whatever, how hard is it? Any question?
Doctor, actually, I have a question. Is this towards the end of the session?
Habislah 1 jam je. You 2 jam you merapu punya otak you tak nak masuk dah. You bukan otak je, kita orang 3-4 jam boleh concentrate. You almost you concentrate 1 hour je sebenarnya. After that you tak start dah fikir pasal cerita Korea dan sebagainya dah. Ada apa ha?
So, tadi doktor tanya pasal severity of respiratory distress. So nak confirmkan. Jadi sebenarnya patient ni dikira fall under apa?
Fall under apa?
Kalau referring to Musawas list just now that we discussed together, dia points more towards mild.
The one, break lah. Okay
But kalau in terms of severity of because we suspect this patient to have pneumonia. So is it different severity of respiratory distress and severity of pneumonia itself?
Yeah. Macam cakap dia. In this class, you think I'm teaching you what I'm teaching you, you think? How to make diagnosis, to think, how to think, or diagnosis? Which one I'm teaching you all?
How to think.
Is it important to make diagnosis now? Which one more important? How to make diagnosis or the diagnosis? I'm teaching you what?
How to make the diagnosis.
So in this class, is it important? Is this asthma ke, pneumonia ke, whatever ke? You think important or not? In this class, currently.
Second important. Second important.
Pardon?
Second important.
You see, you see, if some people say it's pneumonia, some people say it's asthma. Do I argue on that or not? Just now, do you think I argue with you all or not? Is it pneumonia? Is it asthma?
No.
What I argue with you all? Why you diagnose asthma? Why diagnose pneumonia? This is my class all about. Do I bother about the diagnosis?
No.
Why is it I don't bother? Because you all don't know how to make diagnosis yet. That's why I don't bother about your diagnosis. Because you all have not yet know how to make the diagnosis. My class is teaching to you all how to make diagnosis, that's all. Because from the history, you know what happened? I will go back to the patient, I will clear out myself. Then only I can make diagnosis. When I listen to history, I cakap, I have to go back to the patient, I have to clear the patient on my own. Then I will get the diagnosis. Understand? You get the message or not? I am more teaching you to wire your brain to become a doctor, not a engineer or a lawyer. That's my class all about. To wiring your brain though. Okay, any other question? Tak dengar lah, weh, Zakuan.
Okay, sorry. Okay, I just want to ask about the 9 aspects that Musawa mentioned about the respiratory distress just now. It is in the PITS protocol about severity of acute asthma. So is it still eligible for the other cases that present with respiratory distress too?
What's wrong with that?
No, I just want to make things clear.
You have to adopt lah. You have to adopt. Understand? You don't use all, but there are some practical points can be used. Is there anything wrong there? The one you can use is the wheezing only. But in bronchopneumonia, they are the aspect of infection. So we want to know how septic the child is, which is not inside the septic. The child also infection, pneumonia don't have infection. So that they expect that the child can have mild respiratory distress, but the child can be so septic. But our discussion is about respiratory distress. We not discuss about the septicemia. Okay, any other question? Tak ada? Sudah? Habis?
Doctor, maybe the last question lah, Doctor.
Ada apa?
May we know the marks of our PBL?
CBL kan member lah. Tapi nanti you tanya dia orang, biasa hantar sendiri pada tu.
Oh, okay.
Okay, You rasa patut you dapat berapa?
Over 10 ke? Over 10 dah.
Over 10, berapa biasa patut you dapat you rasa?
We think I personally think 8.9, but
you sudah 8.9.
Maybe lah.
Despite of you unable to analyze the history, despite of you don't study at night about this case, you tak malu kan? If you think that I'm talking about presentation alone, you don't think that I can read between you, are you prepared, really prepared about the case or not? Think about the case or not? You think that I cannot assess you going to read about this, they are going to present this case, I want to read, I want to see about this case, I want to analyze this case, ni semua, then I'm going to present after that. The fluency, from the fluency we know that ni baca bos sekali, 2 kali baca ni. I have teaching for 25 years lah. I know what the students should be if they really prepare the case. How they discuss the case. I have teaching. I know even you all, I can compare your level compared to previous another 20 batch. Where you all? When the presenter prepare the case properly, even somebody else case, we know the way that he present and the way the discussion, he do his homework. He did his homework. Okay. Kadang bagus muhasabah, tengok where you to get to be better before, to be better later on. Any questions? Okay, I dah teaching Mak Saleh, I dah teaching Cina, India. You must realize that. I Melayu, I dah teaching whole group of people. I know how Mak Saleh punya way, I know the Chinese way, Indian way. I know how they present. You can present how they prepare the case. Okay.
Okay, jom Asa.
Ya, serius ke habis macam tu?
What happened? Takut.
Afi penyelamat lah.
Tak dapat jawab sana. Doktor upset ke tadi macam okey je dia?
Doktor sakit sebab
akhir tu dia macam like, korang ni do you deserve? Ya Allah, 8.9.
Kenapa dia tak puas hati? Dia marah ke?
dia tak marah sih. Dia macam okey, tapi dia macam dia tegur, tapi dia tegur tak marah-marah.
Kejap guys. Session ni record.
Aku
Bye.
baru aku buat satu link baru.
Link.